everyone. She has spent nearly a decade at the intersection of physical therapy and digital health, helping reimagine what care looks like when it's no longer confined to our four clinic walls. From scaling an early stage health tech company to now leading US operations for a platform focused on remote therapeutic monitoring, she's been on the front lines of the biggest shift in our profession that has happened in a long time. At this time, when we are facing shortages in staffing, patient demand is exploding, clinicians are burning out, she's asking some bold questions. What if better care isn't about doing more, but instead building smarter systems? And what if physical therapist assistants could finally practice at the top of their license with AI and remote care models doing a lot of the heavy lifting for us? Today, we are diving into the future of hybrid care and AI practice, how that fits into our everyday lives as PTAs, and how PTAs can help this evolution of rehab. So we would like to welcome today's guest, U.S. General Manager for EverEX, Ellen Morello. Am I saying that correct?
That's correct. Yes.
Great. But first, before we get started, I just want to remind our audience, if you are a PTA who is looking to level up your skills, stay current and earn CEUs that actually matter for you, our partner at MedBridge offers industry-leading education built specifically for rehab professionals who want to grow into their careers without wasting their time. And the best part is you can get a discount now with my promo code. So head to ptapluspodcast.com and use the code PTA Plus, and that's PTA PLUS, to save on your MedBridge subscription. That's PTA Plus at checkout. Invest in your growth because your career deserves it. So Ellen, we can go ahead and get started. Thanks so much for coming on.
Thank you so much for having me, and thank you for that very nice intro.
Absolutely. Yeah, I've been following you on LinkedIn for a while. RTM and AI is kind of a space that I'm extremely interested at right now, at this interesting intersection in my own career, because I've been in PTA education for a long time, and I've been a PTA for a long time. And it's just so interesting to me to see how things have changed. Now, I was like anti-AI for a while. I was like, no, it's going to take over our brains, and how will we ever think for ourselves? But now it's like integrated into my everyday life, right? It's like this has totally taken over a lot of spaces that I used to use other tools for instead. And it's easy and it works. And why aren't we using it to leverage for better care? So, lots of questions around that.
Yeah, absolutely. No, I think it can be scary, but once you're exposed to it and you understand that there are guardrails in place and you can learn how to use it effectively, then it's a great tool for everyone for day-to-day stuff or clinical stuff.
Yeah, and we hear a lot about staffing shortages. I hear this a lot on this show, and I don't even have a daily show. Like I'm interviewing people like maybe once a week or something like that, and I hear it a lot that we have staffing shortages. So what are you seeing from the digital health space that clinicians might not be fully realizing yet about staffing shortages and what this looks like on the digital side? Like, what are you kind of seeing?
Yeah, I mean, I think, initially a lot of PTs and PTAs, there's like fear that, technology is going to like take over. But the reality is, right, day to day, there's so many openings for PTs, PTAs. I think we have an aging population. We have so much demand for our services. And it's nationwide. It's not just in certain areas. Like nationwide, there is a huge staffing shortage and PT shortage, and people who need care aren't able to access it because clinics are short-staffed and maybe have wait lists. So in general, though, I think on the digital side, there is a lot of interest, right? I think when I would post remote-only jobs, like they do get a lot of applicants because I think clinicians are burned out and they want some of that flexibility, and there's a real desire to have that model and have that flexibility. And as an employee, people enjoy that work style. I think clinics are challenged to find the right mix of patients wanting in-person and offering virtual services too. So
Mm-hmm.
that clinics, I would say, are kind of trying to balance as they figure out their own staffing models.
Yeah. Yeah, that's an interesting take on it, because I think you would have you probably have a certain subset of the population who is like, yeah, definitely like hybrid, that fits with my life. But I would say that probably the majority are interested in that still face to face, hands
Mhm.
on kind of care.
Right.
Yeah.
Yeah, I do think in person's not going away. Patients still prefer it as a care model. I think virtual allows access and can help both sort of like at the start of care and at the end of care, but is not going to ever replace the need for in person, right? Like
Hmm.
patients still really want that hands on care, want that dedicated time and space to go and focus on their care. But if they're waiting several weeks to get started, maybe they could get started with virtual. Maybe they could engage in some exercises at home before they're able to get into the clinic, or at the end of their care as they're starting to gain more independence. Um, it's a good on and off ramp, I would say, to
Mm, yeah.
in-person care.
Yeah, that makes a lot of sense. Access, just in and
Mhm.
of itself. I just recently talked to a family member who was looking into pelvic health and couldn't get in. There wasn't a pelvic health provider that was really within about 30 miles of
Mhm.
where this individual lived. And so they were able to start an online hybrid kind of model initially anyways. And like you could argue about this all day long, like what's better, in person, hybrid, however it is. But the fact that this person was able to start getting some care
Mhm.
rather than no care at all was, the important part. That was the key, that she was able to get started on something when there is nothing that she could access that was
Yes.
close by. There was nothing
Yes.
drivable.
Right, exactly. And sometimes they just really like patients really just need some peace of mind too, to know that like so they don't go to the emergency room for an episode of low back pain or something. They just need to know like what's going on and know that know what they should do. And I think as a PT profession should be that front line for musculoskeletal injury to address those concerns, so people aren't in the ER for back pain or
Right.
as frequent, right? When they could be doing things to symptom manage at home and understand what's going on, and kind of triage their condition.
Yeah. And you are a physical therapist yourself.
Yes.
Like you know what you're talking about whenever it comes to patient care. This isn't somebody who has a high level position at a tech company that has no idea what's happening in the day-to-day trenches of physical therapy. Like you've lived it before. You've
Oh,
been
for
in
sure.
there.
Yeah.
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 Yeah. So for physical therapist assistants who are listening, which is the majority of the audience that listens to PTA Plus, but how would you explain a remote therapeutic monitoring role? Something that makes sense to them, like what a day-to-day kind of job looks like in that RTM space.
Yeah, yeah. So your primary job is to monitor patients. So what you're monitoring is, and it could depend on like the tools that the RTM softwares that you're using, but the data that you're usually monitoring is like adherence to home exercises, fielding questions from patients that come in over messaging, reviewing kind of a clinical snapshot. So sometimes the data that you're looking at is pain scores or patient reported outcome scores, or like symptom scores, or maybe they're indicating that certain exercises are difficult, or maybe they're indicating that they're ready for progression in their exercises. Um, these are all different types of data that certain softwares could be collecting about patients. But the monitoring clinician's role is to take a look at their dashboard that is showing all of this data, and make an assessment of the data. Does this patient, you know, Can you, using your clinical brain, usually that's where you're kind of messaging the patient. Oh, I felt a little pinch when I did, this exercise. And then you're kind of saying, okay, is that a new symptom, or is that consistent with your kind of current presentation? Do you need to alert the PT if there is a new symptom? Do you need to let the PT know that the patient's doing great and is ready for a progression? Or do you need to let the PT know this patient's not adhering, and, just so you know, they're not doing exercise? Like, you're communicating with the PT, that is usually someone on site overseeing the care plan, and then reviewing that data and kind of making an assessment. What does this patient need, either to progress in their journey? But yeah, it kind of depends on the software, because certain softwares are collecting different data points. Some of the RTM softwares out there have sensors. Our software has a range of motion computer vision tool, so we could track range of motion over time if that's clinically relevant. So it kind of depends on the software that you're using and what the data points are. But yeah, you're looking at the data and responding to patient questions, or encouraging the patient. If they haven't done their exercise, check in, see, hey, what's going on? Notice you haven't been doing your program. Did you have any questions? Those types of things, where you're making an action and an analysis based on a snapshot of data.
So this is an adjunct to what's already happening in the clinic. So this patient could still be attending their regular sessions, and this is just kind of like an extra piece that's helping keep that patient on track, that's helping get that best outcome at the end. It's not necessarily replacing anything.
Exactly. Yes. It's great for patients that maybe can't come into the clinic 3 times a week, that need a little bit more, exercise at home, or patients that have more involved conditions that need more, kind of home exercise. It's great for patients that, just like aren't going to be as compliant. So you really want to give them an extra tool to get them to sort of have that care, access to that care at home. And that, we know that exercises work best when they reach a certain dose. You can't just go to the PT once a week and hope that your condition gets better. So you need that extra. If you need that extra level of support, then RTM is a great adjunct to in-person care or virtual care, depending on the kind of care model.
So how do you see the PT-PTA relationship evolving in RTM or hybrid roles? And where do you see PTAs offering the most value or creating the most value?
Yeah, I do think it is in that communication, since the PTA is then the one that's kind of in touch with the patient a bit more in between sessions, where they're probably picking up on what's going on at home, and what the patient needs to be successful, and communicating that back to the PT. I think it really does, you still have to build that rapport. You still have to feel like you're really working in tandem, and have that trust and that relationship. And I think our PTAs that are providing monitoring services, the ones that are successful, are really proactive in communication with the treating PT, and saying like, hey, here's what's going on with your patients. Here's, this patient probably needs an adjustment. This patient probably, hasn't been doing so good. This patient reported some new symptom, and kind of being proactive with like that communication. I think those PTs really build that trust, and I think they are using really good clinical judgment too, because they're saying like, maybe this one needs an adjustment, because they're the ones that are kind of seeing day to day what the patient is doing, what the patient's not doing, what the patient's having difficulty with, to give that information back to the PT.
Yeah. So, it's very interesting because I actually was having a conversation with a group of PTs a couple of weeks ago regarding RTM because like I said, I've kind of been like poking into this a little bit because I'm like, this intrigues me. I want to know more about this. I'm all about any way to progress the PTA and to get them into careers and roles that they love. And
Mhm.
that to me can look very different. It could be a variety of things. So I'm against saying you got to only do this route for your career. I want to see PTAs doing all kinds of things. So but I've been talking to some PTs about RTM, and these are clinic owners. These are people who own their own practices. And what I kind of hear from it is that, yeah, I mean, this sounds like a great adjunct to what we're already doing. But man, I don't know, like, how do I start that? And it just seems like a lot, and like, I don't know if I have the manpower to make that happen. So, what would you say to a clinic owner who knows what RTM is, but is kind of like hesitant to implement or
Mhm.
doesn't know what to do, like where to start? What would you say to them?
Yeah, I mean, I think there's a lot of resources out there, and kind of educating yourself about RTM is a great starting place. I think, uh, and I kind of want to separate the like billing side of RTM from like the care delivery side of
Sure.
RTM,
Yeah,
because the billing is nuanced, and I think that it does require just a base level of understanding and knowledge too, because we're talking about data transmission, we're talking about monitoring time. These codes are separate.
of
It
course.
doesn't follow 8-minute rules. Like so, there's a
Mhm.
lot of nuance to the billing that I think people need to learn about as they're implementing RTM. But from a care delivery side, I think it's really just like understanding your patient needs, and if you think this would be a value add service. A lot of the vendors have great implementation teams to where they could guide you through like, hey, here's how to make this program successful, or courses, resources, all of that. If it's a lack of education or if it's a lack of like confidence that it could be successful, I think because a lot of vendors we have seen a lot of different types of clients try to implement RTM. So what's been working, what's not working. And I think the vendors can actually be a really great resource of like, okay, you're thinking about this. Well, here's how you can make it as successful as possible at an organization that looks like yours.
Yeah, that's great. So when you say vendor, what does
Yes.
that mean to your average person who is just learning what this means? Like,
Right, right. So, I mean, a RTM software vendor. So, EverEX, where I work, is a RTM vendor. So we would partner with the clinic to make the RTM program successful, whether that is a combination of software or training or services, clinical services. Some vendors just offer software. Some vendors, have integrated software and services. um, so there are a lot of different RTM vendors out there. But if you're going to do an RTM program, you do need a software to do it. So choosing the right software vendor is what I mean.
so
Or
picking the vendor and the software that's the best fit for the needs that you have in your clinic space.
right, exactly.
Got
Yeah.
it. Got it.
Mhm.
So, what does it actually look like, in your opinion, for PTs and PTAs to work at the top of their license when we are integrating technology like RTM and AI? I mean, AI to me is really starting to break into the physical therapy spaces, and just from the conversations that I've had with a lot of people through APTA and where I live in Ohio and whatnot. We can't be on the back end of
Mhm.
AI. So we really need to get at the front of this, right? So
Mhm.
in your mind, what does that look like for us to really utilize those tech skills at the top of our licenses, PTs and PTAs?
Yeah, yeah. This is something I get real excited about because, like, it, in a perfect world, we would all be doing this and it would just work great. But there's realities of day to day. For PT, I think it's really in that kind of diagnosis, assessment, setting up the care plan. And once you've kind of assessed the patient and come up with your diagnosis and care plan, then I think it kind of can then, PTAs can kind of take over some of the care plan, drive that, adherence, drive that kind of day-to-day clinical value. And then the PT is there checking in, overseeing, reevaluating, and kind of adjusting. But then the PTA can be really doing the bulk of that, like ongoing care relationship, I would think. And then with the technology, though, like you could really make everything super efficient in terms of, there's a funny kind of ethical dilemma with AI, right? Because there's unethical use of AI where you could not be protecting the patient and things could go rogue. Mm-hmm. But I also think there's an non-use of AI can also be unethical, because if you have a tool that can help you better diagnose or treat a patient because it's pulling from huge databases of clinical literature, that you are also doing a disservice to the patient.
Very interesting spin.
Absolutely. Because, right, sometimes if an AI could prompt you to say like, "Ooh, this patient's at risk for X, Y, or Z," or this, you've put in a diagnosis code of this, and best clinical literature is saying that this is the best treatment for that, then maybe you as a human cannot stay on top of all of the clinical literature, and new stuff's coming out every day. So if AI is able to like access that and make suggestions, obviously it would always be a suggestion. I think that's one of the AI safeguards, is that AI could suggest, but not actually treat or decide what the patient needs. Then you're better informed as a clinician, and you might miss something that the AI can detect that you as a human wouldn't have been able to.
It's all in how we prompt and utilize the tools that are at our fingertips, right? Mm-hmm. So like of course, my fear of AI is going to take over my brain. I'm long past that fear. That's gone now. But I have definitely learned that I have to make sure that I'm using the tool correctly. So like any other modality that we use in physical therapy, right? Like if we're going to use it, we need to be trained on it. I had to be trained on certain techniques before I was safe to use them in the clinic. So I think that there's a whole layer to that as well. It's so funny that you mentioned the AI can give you suggestions. I was actually earlier today, I have to file taxes for my children's work, their summer jobs that they did. And I'm like, you know how long it's been since I've had to go online and like file tax. But anyways, so I'm like in Chat GPT, I'm like, tell me step by step how to file my child's taxes. And it immediately came up and said, be careful. It said something like, careful not to give tax advice or something like that. So it was even telling itself, like, don't give this person advice, just give them a step-by-step prompt,
Right.
I'll deal with the taxes later, but.
Well, yeah, because it can't act as a licensed professional. So if you need a licensed tax professional, then AI would have some scope creep there.
Right. I'm like, surely I can figure this out, right? Like there should just be one form. Like they didn't make that much money, right?
Yes.
Yeah.
And for documentation too, right? Like that's something where it's like, okay, boom, 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 this in this field, this in this field. It's like computers think like that already. So it's easy to put data into categories and take out some of the manual labor of something like documentation.
Yeah. And that's the one thing that I'm in clinics a lot. I work with students, and I hear a lot about the huge administrative burden of documentation. And to me, I think that there has to be a win-win here with if we can improve our efficiency with the use of technology and AI to make note writing easier and accurate and ethical ways, why not? You could gain so much more time back with your patient if we could kind of find a way to harness that a little bit better than what we already are doing.
Yep, absolutely. I think it's even easier in a remote environment actually
Mm,
to, because so for example, even in a virtual visit, like you can have a scribe and you're doing one-on-one attention, you're kind of like focused versus like an open gym type of space, right? Like
yeah.
the virtual visits are easier to document from like a scribe point of view.
Okay.
Um, but on an RTM side as well, the software is kind of tracking everything. It's tracking minutes that you're on a certain screen. It's tracking minutes that you're doing certain activities. And it can compile all of that into just basically a readout at the end so that all of your clinical activities are pretty easy to document from that standpoint because the software is knowing what kind of you're doing. Um, so
Yeah. Makes a
definitely,
lot of sense.
yeah.
Yeah. Now at EverEX, you are actively hiring
Yes.
for RTM PTAs, for PTAs to work in this RTM space. Like there are jobs posted right now, so actively hiring. What type of person or what type of PTA do you think is an ideal fit for this type of role? And are there ways that they can prepare themselves for this type of a role?
Yeah, that's a good question. Um, one of the first questions I ask when I screen our candidates is, do you know much about RTM? Have you had any exposure to RTM? Some people, it's still pretty new, so a lot of people don't have direct experience with RTM, but that's okay. I think if they can come in, would just say like, yeah, I kind of understand it. I kind of did a little research on RTM. I've heard about it. I've talked to some people. Just coming in with a little bit of baseline education is I think helpful. In terms of other like skills, I mean, I would not. I'm gonna just express my bias, but like brand new grads, like I think you need to get some clinical experience before you can work in a fully remote role. I think you really
Mm-hmm.
need to see patient care. You need to
Yeah,
really see, you got to earn your chops, so to speak. So I think getting some good in-person clinical experience is valuable before you go to a fully remote role. Um, just because you're better at identifying the data points, and when you're treating remotely like this, you're kind of having to extrapolate from limited data, right? You're not
right.
getting your hands on patients, you're not watching them. You're taking data. And for me, as a remote clinician, it's been really helpful to be able to say, okay, I see how you're presenting virtually, and I've seen, 100 other people in person that look like you.
Right. Yeah.
And I can be a lot better pattern recognition. So if you're taking the data points, which is limited, having some clinical experience is helpful. Um, Remote work is a different ball game too. You kind of have to be proactive, and you have to be proactive about communication with, who do I need to communicate these challenges to? Is it because sometimes it's not always the treating PT, right? You're collaborating with them, but sometimes you're also, for our clinicians, they're collaborating with our product team and our operations team to say like, hey, here's where the product could be better. Here's where, I'm running into challenges. Hey, here's what's working and what's not working well about how our situation is set up. Um, so it's also knowing like, hey, I should tell someone about this internally, and so kind of good proactive communication skills when you're kind of working remotely and no one's overseeing you as like closely as you would if you were in clinic.
Yeah, that makes a lot of sense. Thinking of if someone is interested in this type of a role, having that clinical, almost like intuition. I
Mhm.
was thinking when you were talking about that the PTA should have clinical experience before they come into something like this. You almost build, like muscle memory, right?
Yeah,
Like I can almost feel and sense what this patient's going to do next because, like you said, I've seen it multiple times.
Mm-hmm.
I have a feeling I know what they're going to say next or how they're going to present because I've already seen that and had that exposure versus somebody who's fresh into the profession. They're still kind of learning that skill. So it
Yes.
does definitely sound like this is somebody who's had several years under their belts, hands-on treating patients before they would be ready for something like this.
Yes, I would say so.
Yeah. And really building that clinical foundation too. Like you said, there's a lot of trust involved here. So,
Mm-hmm.
these PTAs, if I'm not mistaken, if I'm understanding this correctly, they're working for you at EverEX, but you are working for the clinician or the clinic, right?
That's right.
So there's an in between there. So they're representing EverEX, they're representing themselves, but they still need to earn the trust of that clinic, and the clinic needs to feel comfortable and confident that they have a good PTA, they have a good relationship with EverEX as well.
Yes, 100%. Exactly. And to some extent, we want our PTAs to feel like they're part of the clinics team in a lot of ways, because the clinics have certain spins on how they like to do things as well. And really, they are working under the supervision of their PTs. So we want them to build the rapport, the clinical rapport with those PTs, and build that trust directly.
So you are kind of leading the way with being in the US operations with EverEX. So how is EverEX actually changing the landscape with RTM and AI in PT practice or in other practice? How would you see EverEX as kind of changing that landscape right now?
Yeah, that's a great question. We are we're really like listening to our customers and what people want and how we can remove any barriers to getting patients enrolled. Those are things that we're really heavily focused on. Um, and what that has evolved into, I think, is number one, we have sort of flexible options for clinics. We have both the software only model, where a clinic could just use our software and build an RTM program. But we also have the model of outsourced monitoring, where those clinics that are too short staffed to successfully do it on their own can leverage our staff, PTAs and PTs, to monitor. We have kind of a variety of options in between as well. So it's being flexible with sort of the design. Then sort of on the software side and the AI side. So where we're trying to focus. So number one, we have a really advanced computer vision technology that captures range of motion. We're founded by an orthopedic surgeon. I think working with orthopedics, right, range of motion is such a critical measure. So we have a really advanced AI model for that. But where we're also going is thinking about AI messaging, thinking about how we can support patient activities, like, is it encouragement? Is it reminders? Where can we support the patient to be more successful? Kind of maybe even some sense of like care plan progressions, where if a patient's been on a care plan for a while and is adherent, like, what's next for those patients? Just a couple of different ways that we're thinking of making AI useful in an RTM workflow. The other side is kind of billing and interoperability, which is a whole administratively focused ballgame, but that is where a lot of pain points lie. Interestingly, too, and another pain point is the insurance landscape, where patients don't always know day one what their out-of-pocket costs are going to be for certain things. Patients don't know, is this going to count towards my visit count? Is this going to, so there's a lot of questions from patients on the insurance side that we're trying to get ahead of, in terms of understanding the landscape and understanding what the patient needs to know and what the clinician needs to know before they sign a patient up for an RTM program.
Right. Yeah. I mean, that's important for sustainability too, right? You don't want to be selling a product that's going to change immediately. Like you kind of have to be cutting edge and at the very front of that in order to make sure that everything continues and it's not, difficult for the clinic to continue to implement. It
Mhm.
has to be something
Yes.
that, yeah, otherwise they're not going to want to continue to do it, right?
Yes. Yes.
Yeah, as we've all seen, if something isn't working well and it's not working smoothly, usually it's like, okay, time to go. So we want to
Yep.
make sure that, yeah, that makes a lot of sense. So for a clinician who's listening and would like to find out more information about EverEX, like where would they go to find information, or where could you point them in the right direction?
Yeah, so our website, everex.ai, is a great place to go. We have a careers page too, so you can see our open positions there. We have a number of blogs and resources too on just on RTM. Um, I will add, I'm currently working on an RTM masterclass with APTA that will be coming up in August. So that will be exciting too. I don't know that APTA has officially announced it yet, but we are working on that. Alice Bell and I will be presenting in August. So that's APTA has some good resources on RTM. And I'm happy to connect with anyone who is curious and kind of wants to learn more.
Yeah, and you are on the LinkedIn space. I meet a
Yes.
lot of people through LinkedIn, so definitely check out Ellen on LinkedIn, and you'll be able to reach out to her there for more information about EverEX and what this is kind of looking like. So, last question: what does the next 5 to 10 years, like, what does physical therapy's new normal look like in the next 5 to 10 years? If we were going to hit that fast forward button that I used to have way back in the 90s that doesn't really exist anymore. But what does that look like in 5 to 10 years? And how should we as PTs and PTAs be preparing ourselves for that?
Hmm. I think there's what I wish it would look like in 5 years and then what it could actually
Go
look
ahead.
like.
Go ahead. Run with your wishes.
Okay, great. Because things change slower than I think.
Yeah,
uh,
I get that.
Yep. I mean, I do like the vision of practicing at the top of our license. I think ideally we would be more right that primary care where patients are coming to PTs first for musculoskeletal concerns, and starting right there. And I think in order to get there, we have to be as accessible as possible. I think the general public still has a perception of um, if they go to a PT, they then have to go to PT for 12 weeks, and
Mhm.
they don't know that they want that all the time. They just kind of want some answers and maybe some stuff to do at home and maybe, a few visits, but they don't necessarily need intensive PT for 12 weeks. So um, I would like us to become more accessible to be frontline for musculoskeletal concerns. And then for the patients that do need care, that there are a variety of care options for them where it's not so set that they must come in person 3 times a week for and to have that flexibility, I think would behoove us as a profession.
Right. I mean, you go to the coffee shop, and how many options do you have? You go to a restaurant and you have options. So everybody else has kind of caught on to this model. So we definitely need to catch up with that. We've got to have options. So
Yes.
I couldn't agree with you more. Ellen, thank you so much. You're a great advocate for not only your patients, breaking down barriers, changing the route to access to physical therapy. And I would say that you're even a great advocate for PTs and PTAs, because we're currently trying to break through into technology and all of these new routes that we can provide care, and we need people like you on the front lines to kind of say, hey, here's another way to go. We have other options as well. So thank you for your time. I appreciate it.
I really appreciate that. Thank you, Katie, and thank you for what you're doing too. I think I love PTAs. I think it's so important that you're helping so many PTAs and supporting the profession. So thank you.
Well, thank you for your kind words. I appreciate you coming on today, and we'll talk soon, Ellen.
Sounds great. Thank you, Katie.
Uh-huh.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision-making should be made from its content. See you next time.